Okay, so this is session 3, and we've got 2 more over the next couple of weeks, which is great. Now if we go on to the next slide. So the particular objectives today are for us to recognise the difference between a behaviour and outcome. And though that might seem really obvious, it's amazing how many of us do get really confused. And if we don't know the difference, then we can't really support our patients. Then we're going to look at how to assess somebody's readiness to change their behaviour, because obviously if they're not ready to change, then you don't want to be barging in with advice. To look at how we can respond to people at each stage of their readiness so that we're actually responding appropriately and, you know, we're staying on side with the patient and not jumping forward. And then that hopefully you'll feel able to support people to change their behaviour using a more structured approach. As I say, we'll use an evidence-based approach which has been developed by psychologists. So the purpose of the behaviour can be described as the outcome. So I've got to put some examples up now. So if you're doing your daily sit-ups, that would be your behaviour because you want to get a flatter stomach. That's the outcome. I want a flatter stomach. So in order to do that, I'm going to do a load of sit-ups. I want to lose weight, so I'm going to eat less crisps because I eat 7 bags a day. Yeah.
Yeah.
And then I want my blood pressure to reduce, so I'm going to take my antihypertensives, my medications. Right, I think as mental health nurses, you're going to be really kind of familiar with these factors that for somebody's health, it will depend on a lot of the physical attributes. So there's things that, you know, we have physically which we can't change, but there's a lot of non-medical factors that we're going to come across that are going to affect the way the person acts and also maybe affect the way they might approach looking at that behaviour or changing or not changing the behaviour. So that can be their beliefs about food, about exercise and stuff. It can be their culture. Certain cultures have different ways of doing things. Their personality, are they kind of a go-getting personality? Are they kind of negative? Their education, how much do they know about stuff and how much are they willing to learn? Income obviously has a massive difference onto what can people afford. Their past experiences, so that might be the past experiences just in life, but of trying to, say, lose weight or change some of the ways they deal with things. You know, if they've been drinking too much alcohol and they might have had experience with other services before and they might not want to go back. The particular circumstances that they're in at that time, so there can be a number of different things that will affect. Obviously, their social stuff, so, you know, how supportive are their family? Are their family actually detrimental to the way they act? How do they get on at school or work? Are those things actually affecting them in a way that they're behaving badly because of the way they're treated? And then, of course, the larger political, economic organisation of society, some of the stuff that, you know, you and me haven't really got control over, but that will affect us. And I'm sure that, you know, in your everyday lives, when you're working with your patients, you're seeing this all the time anyway. So this isn't new to you, but it's something that we should bear in mind when we're working with somebody to maybe try and encourage them to be more healthy. Okay, next slide. Okay, so there's 6 stages. So the first one is pre-contemplation. So what that means is it's before, and contemplation, thinking about. So that means before thinking about. So that person isn't even thinking about changing anything in their behaviour. So you might look at them and think, bloody hell, they're coughing their guts up. They're smoking 80 a day. Surely they want to stop. I'm not interested. You know, if you start talking about it, you're just going to get them really cross because actually that's not even in their kind of radar. Yeah. Next point. So contemplation just means thinking about it. that person is thinking about maybe making some change. They're not maybe quite ready to do it, but they're having a think about it. So that means they're quite ready to take on some kind of information from you, have some gentle discussion. And again, you've got to kind of tread carefully, because these people could go, you know, either way. So it's kind of them getting them to look at the balance of staying as they are or changing, and having a look at that. That's what's caused the decisional balance. And so they're looking at, you know, the pros of staying as they are, and the pros of changing, and the cons of staying as they are, and the cons of changing. Because they're, while you're thinking of the pros, they'll be thinking of the cons. Okay, next one.
Sorry.
That's okay. They're pretty much the same. So preparation and action. So basically, that's when the person is preparing to change, and they're making the plans to change. So they're looking at how they're going to do it, and then making their plans to do it, and then they're actually getting on to do it. And this is easy. If the person is in this stage, the preparation action stage, that's really easy for us as healthcare professionals, because that's when they want information and support. They want our help to change their behaviour. And I think the problem as in the NHS, particularly when we've got sequin targets, etc., we kind of jump in as if everybody's in that stage already. And that's why we lose half our patients, because they're not ready. So it's kind of, when you've got them at this stage, this is great, and we'll work on what to do then. Okay, the next point. So the next stage is maintenance, and that's the hardest stage of all, really, because somebody will have made the change, and then they've got to maintain it. They've got to keep it going. And how often have you seen people who've like got really fit, and then you haven't seen them for a few months and they've put on all their weight, or they've stopped smoking and they've started smoking again? All of these kind of behaviours are kind of really, really difficult to maintain. And again, this is kind of a bit of a rubbish thing in the NHS, in that we don't support people in the maintenance stage. So if you think about in primary care, when people do stop smoking, they're seen for 4 weeks. They're marked as they've stopped smoking after 4 weeks, and then it's bye-bye, and they don't see them again. And a kind of, at the stage where they're kind of most likely to fail, they're kind of on their own. So that's a very important stage, and I think something for you to think about. How can you support somebody during that maintenance stage? Even phone calls can be useful. It's kind of that checking in. Okay, and the last one. So termination doesn't often get used kind of within the NHS, because it means that person would never return to that behaviour ever, and there's not many people that actually refers to. But we all know people who've stopped smoking who are the worst, with smokers around them. They would never ever go back to it. So in that case, they're called, it's called termination. Okay, next slide, please. So this might be familiar then. We're looking at how we can motivate change at each stage of readiness then. So we want to empower people and motivate them to generate their own solutions. And that's the problem with, as clinicians, particularly in general, in general practice, people come up with solutions which can actually just make people want to back away. We want to kind of get the people to come up with their own ideas. So one approach is motivational interviewing. Obviously, we're not going to learn how to do that. It's a massive thing, but we can use an approach. And what it does is it combines elements of style. So we're going to be warm and empathic. So we're going to, be warm to that person, have an understanding of how difficult things are, and use technique. So we're going to use reflective listening, and we're going to develop discrepancy. So discrepancy means, you're talking to the person and highlighting where their behaviour doesn't actually match what they'd like to be. or the outcome that they would like. So when we use this approach, the person or the patient does more than 50% of the talking, and the healthcare professional focuses on listening. And often you'll find in particularly, I'm picking on primary care because that's where I come from, but if you kind of were a fly on the wall, you'd hear the healthcare professional blabbing on and giving lots of advice without actually finding out a bit more about how the person's affected by it. So the majority of the interventions are summarised with a few open-ended questions. So we're trying to avoid getting ahead of the person's level of readiness. Okay, next slide, please. So we've got 4 central principles of motivational interviewing. So we've put up the first one. So we're going to express empathy, and the aim of that is to understand how the person is affected, how they're struggling, what the barriers are for changing, and we're going to listen and reflect. So why is it, I can understand that it's difficult for you to stop smoking. What is it that affects you? So you're giving a sentence of understanding, and then you're asking an open question. Okay, next point. So developing discrepancy. So the aim here is to get the person to highlight the disparity between what they're doing, so their behaviour, and what their goals are, so their outcome. So we're going to ask them a series of open questions and kind of reflect, so that the person works it out for themselves, rather than you saying, well, you say you want to lose 2 stone. You're not going to do that by eating the 7 bags of crisps. You'd kind of turn it round and ask the person. So you'd say something like, so am I right that you'd like to lose some weight and your goal is to lose 2 stone? What is it about the way you're eating that might be preventing you to do that? And then they tell you. So it's kind of just turning it around and getting them to work it out for themselves. Okay, next point. And we're going to roll with the resistance. So we're not going to try and force the person or manipulate them into accepting the way we think is right, because our place is not to judge. As soon as we judge, that person will back away and not want to come back. So it's kind of letting them go with it, but kind of try and get them to think of alternative ways to behave. Okay, next point. And then we're going to try and support them to believe that they can change. So any areas of strength that they have, that we should illustrate that, and occasions where they've been able to do things well, we should reflect on that. And and areas where they've not done very well, we should get them to look at that as a way of learning rather than a way of failing. Okay, next point. So I'm just going to put up some examples about how you might use that in practice. So a person comes to you and says, I'm happy being this size, my husband likes me cuddly, my weight's never bothered. Yeah, so they're not interested. If you give them any information, they're going to kind of back off. So what do we do in this situation? Put the point up, Vaughan, please. So we're going to be curious. When I was taught motivation in interviewing, the person that taught me always said, put on your curious hat, kind of like being a detective. So the more you find out about that person, the more you can understand about why they might be behaving in that way. The more likely it is that you can have conversations to bring them to a natural conclusion. So you're going to talk to them, you're going to look for discrepancies and highlight those gently. You're going to listen for any change talk and kind of focus on that. And if they do show some information, ask them permission to give advice. Oh, you seem quite interested in some exercise. Wait, would you like me to tell you about some classes? And if they say no, they can say no or yes without feeling that they've failed you. Okay, next slide. So this is an example. So the patient says, I can't exercise because my knees are bad. Okay, next point. So this response might cause conflict because the person might feel they've got to take on the advice that's been given by the healthcare professional. You could try some non-impact exercise such as swimming or an exercise bike. So if that person is just using the knees as an excuse and the healthcare professional comes up with this suggestion, they're just going to go, no, I can't do that because I fall off my bike, or oh, I can't swim because, you know, I'm not going to let anybody see me in my swimming costume, or it's too expensive at the swimming pool. Yeah, they'll come up with like a list of excuses. And then as a healthcare professional, that feels awful because then you're just trying to think of yet another thing to do and yet another thing. And also you just end up being in this kind of vicious circle of not really getting anywhere. Okay, so another response may be, oh, I'm sorry to hear that. Kind of empathy, showing that you understand. Are you aware of any exercises that won't affect your knees? And that way the person can say, no, I'm not, can you tell me? Or they can say, no, I'm not. And you, as a healthcare professional, you can say, well, I know of some, would you like me to tell you? They still can then say, no, thank you. You're not having that conflict and you know where you stand. Or they can say, yes, I do, but I can't do them because. And even though we're kind of in the same place, that conflict isn't there. We're still, and the person doesn't feel judged. Okay, next. Right, so this time the person's response, my rubbish diet does bother me sometimes when I can't get jeans to fit. No, I did try to diet once, but all I got was smaller boobs. So they've shown some interest in making a change. They might be able to receive some information and they might be able to discuss the barriers. So again, as I said, you want to tread gently here. Just put the points up, please, Vaughan. So this is what when I describe the decisional balance. So you're going to be curious again, and you're going to amplify any change talk. So anything that they say that you think, oh, that sounds like they're going to want to do something, you're going to hook onto that. And then you work with them to consider the pros and cons of making a change, and then the wins and losses of staying just how they are. So as I say, as healthcare professionals, we tend to very often just talk about the pros of everything when the patient's sitting there thinking about the cons. And they might be thinking of the pros of staying as they are. So I remember, for example, talking to a man with bipolar disorder about smoking, and I was asking him about whether he wanted to stop and what his issues were. And his reason for smoking was the fact that he liked to go outside with the rest of the group to smoke, and he felt like he belonged to a special set of people. So kind of that was, it wasn't about the smoking, it was about that being part of a group of people. So actually, if that's the case, maybe what you'd work with a person like that is getting them to be more engaged with a group of people rather than, you know, focusing on all the smoking stuff. So it's looking at motivation can actually change the way you approach a person. Okay, next slide. Right, the person says, right, I'll give it a go. It's been worrying me a lot lately. I think I'll have a bit of a go at eating more fruit and veg. So obviously this stage is quite obvious. Pop it up for. So we're at the preparation and action stage. So that person is planning to change and they're making the preparations to have a go. Okay, and as a healthcare professional, as I said to you before, this is the bit that's kind of easier for us because they're open to getting information. So obviously you remain curious, you ask lots of questions and find out what their motivation is and what might encourage them to do stuff. So you can give them leaflets, you can tell them the evidence behind stuff, you can tell them stories about how other people have done certain things. And then you can help the person to set a goal, and we'll be looking at how you do that in a moment. Okay, next slide. Okay, so they come and see you and they say, oh God, I've lost 3 pounds and I can swim 10 lengths. It must be enough, surely. So at the maintenance stage, so the person's made all the changes, but they're finding it a bit hard to keep motivated. So they've made the changes, they've been satisfied, and they're maintaining the gains and keeping with the change, but it's a struggle. Okay, so what do we do as a healthcare professional? We're going to listen and reflect on their successes. We're going to offer more choice in ways they can achieve the change. We might introduce a new goal to complement their current change. So if they've, for this person, they've added exercise, you might want to start talking to them about their diet. So we would do one at a time, but actually if they're doing well with this, maybe looking at their diet might help them as well. You're going to be a mirror to their success. That's what will help to keep them going. And you're going to encourage them to talk positively about what they're doing. Okay, next slide. So this person's really missing their cake and their booze. Obviously, that's what they've given up. And no one's really noticing anymore. And often that's the case, that you see people, you know, they're started to look fit and healthy, lost weight, and people go, oh, Brian, you look great. Have you lost a bit of weight? And that's kind of really encouraging and helps people go. And then after a while, when nobody's noticing anymore and there's still kind of, it's still hard, they're kind of thinking, well, oh, is it worth it? So the stage is, it's still maintenance, but what we're trying to do here is prevent them having a relapse, because they're losing motivation and they're getting kind of negative. So what we do as a healthcare professional, okay, so we want to reassure them and we want to offer them strategies to help them. So again, curious. That's if you're unsure, just ask a question. So what are your thoughts about why you feel this way? So you revisit the decisional balance. So that's the pros of staying as they are and the cons of changing. And then review the goal. So is that goal actually pertinent to them now? Maybe they need to change it and do something else. Okay. So we've got Mr. Jones. He's 43. He's got type 2 diabetes. He's got a BMI of 34, which means he's morbidly obese. As soon as he enters your room, he says, don't tell me to lose weight. I've had patients say that to me. So what I want you to do, or discuss how you do, is how, as a healthcare professional, you would respond to this. So you're not going to give him any advice, but you're going to be curious and empathic. So maybe in your groups, if you could come up with, you know, the first phrase that you might say to him as to respond. So if I give you about 3. So this next bit is just maybe looking at some evidence-based ways of supporting people who are ready to make the change. Okay, next slide. So there's a psychologist called Susan Mitchie, who I've done a little bit of work with. She is in London, and they've developed this model called the combi model. Basically what it's saying is, if the person doesn't have the capability, so actually they're not able to do it educationally or physically, mentally, they don't have that, if they're not motivated, so they don't want to change anything, or they're, you know, maybe they're doing it on behalf of somebody else. It's not their reason to do it. You know, they're doing it because their husband, wife, mother, significant other has said, you better go and do X, Y, Z. Or they don't have the opportunity, so they've chosen something to change, but actually the way their life's set out, it's not possible to do, to you know, carry out the actions in order to achieve the goal they've set. If any of those are missing, that behaviour can't be changed. That's all it is, basically. So, but it's just a good thing to remember when you're setting goals with a person, because sometimes they might come up with something and you can think, well, they're not going to be able to do that. They're not going to be able to walk to work if they've got to get in a car and go to a meeting, or they're not going to be motivated to stop smoking because actually they've told me they really love it and they don't want to at the moment. And then capability, they might say, well, I'm going to run a marathon every day. Well, actually, if they've been sat on the couch for the last 2 years, that's not going to happen. So those are the things to kind of consider. Okay, next slide. So the structure in which you might support a patient can be broken down into these different levels. So first of all, you need to set the goal with the person, then you're going to plan the action. They're going to, the person is going to record the action and then come back to you so that you can both review the progress together. You always have to give positive feedback and support them with their relapse. So that sounds quite simple. We're going to go through each one individually. So put the first one up. So I'm sure you've all heard of goal setting, and I'm sure you do this with your patients for different things. So the goal gives something specific for the person to aim for. So it's what they want to achieve. So it's smaller than losing weight, but it has to be specific and measurable. So what the experts say is achievement is much more likely if one goal is set at a time. So if somebody wants to lose weight, for example, you would talk to them about, well, you can either do some exercise or you can concentrate on your diet. They would choose one. Whatever's easiest for them is the best to go for. Some people will want to do 2 things at a time. I would encourage them not to, but if they're really set on doing it, sometimes they need to do that in order, and even if they fail, it's worth doing just if they're motivated. And this is the problem with when you think about things like targets in sequins and that, because I'm sure for those of you who have followed the sequin targets and that looking at health checks that you're supposed to do, they say give them smoking advice, give them diet advice, tell them about exercise, tell them about alcohol. God, you know, that person's being bombarded and you're just telling them and then they're expected to go off and do it all by themselves. So if we're looking at one thing, we're looking at one thing at a time in order for that to work. So their goals should be related to a behaviour. So that needs to be obvious to the person. So a behaviour such as walking, cycling, swimming, whatever, and it should be SMART. So I'm sure you've heard of SMART goals, and I think there are some different definitions of what's SMART, but this is the most basic. So specific: who, what, where, when, how often, with whom, in what context. It's got to be measurable. So you establish the criteria. So are you going to measure how long they're doing something for, or the intensity of what they're doing? So it obviously it depends on the behaviour, how you'd measure it. Is it achievable? Is it realistic? So the best thing is to start smaller then to build up. If they start looking for something too big, then they'll fail, and that's difficult. And is it a relevant goal? Does the person actually understand the link between their goal and the desired outcome? Do they realise that if they're going for a walk that they might lose the weight they want to do? And that might seem obvious, but some people don't. And the time that you set needs to be realistic and what works for the person, not what we think is right. So we all work at different rates. So we need to kind of work with that person. Okay, the next slide. So it kind of works when you're working with patients. It works if you've kind of got a form to look at, and because they can see it and you all know what you're doing together. So for this, when you're setting the goal, it's really good if they can see what the required outcomes. So We know how long they're going to do it for, how often they're going to do it, and the rate they're going to do it. And then also you've got some boxes here for the pros of doing it and the cons of doing it. And if you work through this before you send them away, then you can actually identify barriers which might stop them from achieving this goal. And if you identify the barriers there, you can change them or work through them. Okay, next slide. Right, so now we're going to look at setting the goal. So we're going to have Mr. Jones again. He's decided that he now wants to lose weight. So his diet's poor and he does no exercise. So as a healthcare professional, we're going to help Mr. Jones to choose which behaviour, diet or exercise he might want to tackle, then assist him to set his goal, where, when, for how long, by. So what are pros and cons of his chosen goal? So if I give you, we're going to go back into your groups and give you 5 minutes this time. And if you can come up with a goal for Mr. Jones and what his pros and the cons of that goal might be. So the goal is going to be SMART. Right, so the next thing you would then do is plan the action with the person, and it's really good to link the action to something that they're doing already. So something like taking medication. So we often forget that medication can be a really good thing to help people with their health, that is a behaviour. So like if it's they've got high cholesterol, the best thing you can do to lower that person's cholesterol is get them to take a statin. That's going to help them more than exercise and diet even. So if they take it with their breakfast, it's kind of like getting them to do it so that they don't forget. They kind of link the two together. There should normally be 4 components to the action plan. That doesn't always work depending on what it is. So where are they going to do it? When are they going to do it? Who they're going to do it with? We've talked about that already. And how long are they going to do it for? And again, some of you have mentioned this, involving other people can be really helpful because it's motivating. So going to a stop smoking group or a Ramblers or Slimming Club, exercising with a friend, planning their shopping and meals with a partner, if there's somebody they're living with and cooking with, or flatmate. So just as a reminder that if you are referring people on to different groups and stuff, what the evidence tells us is these people will still need that kind of one-to-one support from you. They tend to drop out of groups if they're left on their own. They kind of still need that kind of individual help from you. So doing this, if they do go off to a group, I would kind of encourage you to keep checking in with them. Okay, next slide. So this is an example of an action plan. You might put the target date. So for example, 2 weeks from this appointment. So that's basically your target date is going to be the next time you review them. So this is something to bear in mind about when can you review them. There's no point in saying, right, do that for the next 2 weeks and then you can't see them for a month. So if you're not going to see them in a month, make that your target date, just so that actually they can check in with you, or make it 2 weeks and have a phone call. As long as you've got that contact, that target must be when they've got contact with you. So here's an example of an action plan of somebody who's going to go for a walk. So it's also kind of thinking back about the things they need to do before they do that behaviour. It seems so blinking obvious when you write it down like this, but actually, if you don't do this, these are the things that stop people from doing stuff. So this person's going to have a walk in the morning. So they're going to set their alarm for 7:15 and get all their stuff ready the night before, so that it's all easy to do when they get up. They're going to get up when their alarm goes off. That's 15 minutes earlier than they normally would on those particular days. they're going to collect their friend who they're going to walk with, and then they're going to walk briskly to the post box and back again. So kind of it makes it really clear that that person's not going to get up late because they haven't set their alarm. They're not going to not go because they're fannying around trying to find the clothes and stuff they need. Yeah, all the things that you think might stop them doing it. And these are the good conversations to have when you're helping somebody plan their goal and their action, is what would stop you doing that? What would get in the way? So you kind of thinking beyond, you know, it's like if somebody says, I'm going to have Weetabix every morning. If they haven't bought it when they do the shopping, they're not going to have it. And that sounds so obvious, but sometimes these are the things we kind of need to plan. Particularly if somebody's, you know, got a mental health condition, they might need it to be more obvious. And then they're going to record the action in that box there. Okay, next slide. So when the person records their action, it's really useful for us when we're reviewing them because it gives a realistic picture of what they're actually doing. So they might come in and say, yeah, I'm doing really well. But actually, when you look at what they've done, that might not be so great, or vice versa. They might come in and go, oh, it's not been very good. And when you look at what they've done, it's been brilliant. You know, they have made some improvement. So that way you kind of got a measure of how they feel about what they're doing. You know, are they feeling good about what they're doing, or are they feeling a bit lost about what they're doing? So that will help the way you respond as well. If they see some evidence of their success, that can help them as well. We all like ticking boxes and seeing that we've achieved something. That can be really helpful. And it can also identify problems in achieving the goal. So if you can see that they're not doing something on a particular day, you might say, well, what is it, you know, on a Tuesday that seems to stop you going for a walk? Or on a Wednesday evening, you seem to not be able to manage with your eating so well. And that might be because somebody's coming round and they're having a few pints and extra crisps, you know, so you can actually work out what that problem is and discuss it with the person and maybe look at ways of getting over that. Okay, next slide. Right, so you as a healthcare professional should help them decide how they would measure their action. So some people like ticks, some people like to write a load of stuff down, some people just want to put a smiley face. So again, it's what works for the person, and it really also depends on what it is that they're doing, and you might want to make particular forms for that person. Okay, next slide. And I think I've said this already. Okay, so now when we review the progress, we need to greet them with an open question. So how did you get on last week? So that gives them the opportunity to explain their progress or lack of it as they're seeing. So looking at the next point, if you go in and say, did you manage to walk 3 times a week? Would be really awful if they actually had only managed to do 1 or they haven't done it at all, because then they're just going to feel like they failed. So if you say something like, how did you get on last week? It gives them the opportunity to explain how they feel they've got on with it. And once they've described their progress in their own words, then you could look at their plan, and then this will help you to understand what the person's actually achieved compared to what they think they've achieved. And again, as I said before, that there can be a disparity there. Okay, next slide. So this obviously could seem really obvious, but we don't always do it. If they've achieved their goal, it's easy, isn't it? Because we can give them the praise, they're really happy. And then you can decide together whether to keep that same goal to make sure that the change has been achieved is stable. Maybe they need a bit longer, or if it's appropriate, maybe you can move on. I think somebody was saying that, you know, walking for 10 minutes, maybe if that's been really easy for the last 2 weeks, you could increase it to 15 or 20 minutes. But if it's been a bit of a struggle, you might say, well, you've managed it, let's keep on doing it for a little bit longer at that time till you get a bit fitter. So everybody will be different. So that's the easy way. It's a bit more difficult if they haven't achieved it or only partly achieved their goal. You can still praise them for any effort they've made towards achieving it. And you can even praise them just for turning up. That's a good thing. Oh, well, I'm really pleased that you've come. That's really good. Let's see what we can learn from what's happened, because we can always learn, you know, what is it that stopped them doing it? Maybe the goal isn't the right thing. Maybe it's they actually haven't got the motivation to do it. Maybe it's just something else that they need to do. So actually having that discussion is really, really good. Okay, next slide. And positive feedback. We should always give positive feedback in a way that's not patronising. If we're positive, that promotes them to be engaged and it can keep them motivated to continue. And we all know that it's great if our managers say to us, you know, you've done a good job. Even if you're feeling really, really fed up and thinking, I'm going to leave, I hate this place. And then somebody comes up and says, oh, well done, you've done a great job there. You kind of think, oh, maybe that's not so bad, or I'll carry on. So it really can help us. So there's two different types of feedback that you can give. So there's the very general feedback that's positive. It's really great to see you. Well done on how you did last week. That's all good. And then you can actually feedback on the different. And this is a tricky one when somebody's relapsed, but we need to help that person to try and get back on track. And we need to reassure them that this is normal, that actually, you know, it's often when people making a change, it's kind of 2 steps forward, 1 step back and vice versa, that it very rarely just goes to plan. Things get in the way and things are difficult. So if it was that easy, we'd all be fit and slim and be eating healthily and not smoking. It's hard. So we're there to support them. So when we talk to the person, we're trying to get them to see that this is an opportunity to learn about the situations that might make them relapse and how they can avoid them. And then maybe to look at some strategies to manage any kind of risky situations. You know, if they, you know, are they doing something different because they're going down the pub or they're with a different group of people, that, and then help them to try and learn how to get back on track. Right, so just to summarise, in order to support someone to change their unhealthy behaviour, you need to help the person recognise how their behaviour affects them. You need to assess their readiness to change their behaviour and respond accordingly. And you need to use a structured approach to support people who are ready to change their behaviour.